We're so excited to have you joining us today, whether it's live or later by watching the recorded version of this. I'm Marwa Casey. I am the co-director of the Leadership Committee for the International Women in MS, our host for today. And I am an MS clinician and researcher at Cedars-Sinai Hospital in Los Angeles. I'll let my co-hosts Billy and Fiona briefly say hello too before we move on.
Hi everyone, and welcome also from all of the iWiMS team. I am Vilija Jokubaitis and I am a Senior Research Fellow at Monash University, and together with Ruth Dobson, I lead the Mentorship Program of iWiMS. Fiona, over to you.
Hi, my name is Fiona Costello. For those of you who do not know me, I'm a neurologist, a neuro-ophthalmologist at the University of Calgary, and my job will be to stick handle the chat and come up with questions as they pour in, and it's wonderful to see you all.
We've done this before, at least for the leadership group, and Fiona is wonderful at helping move the discussion on smoothly. So she will be monitoring the chat if you want to throw some questions in there as we go along. We're going to keep this pretty informal. Thank you so much to our panelists, Tanuja Chitnis, Nancy Sicotte, and Halmut Butzkueven for joining us today. We really appreciate your time and your expertise. And we're very excited. This is the first partnership between the Leadership Committee and the Mentorship Committee of iWiMS. So we're thrilled to have you and excited to pick your brains on these questions. So we'll just dive right in. I'm going to have you all introduce yourselves briefly, and then what we're going to do is go through some questions, first focusing a little bit on leadership, then on mentorship, and we'll take turns having you take first stab at the question and then invite the other two panelists to share anything else that they might want to regarding that question before we move on. So I'll start with you, Tanuja, but then have all three of you hopefully answer this. Just a brief introduction to yourself. What is your current leadership role? How many people do you lead? And what kind of people do you currently mentor?
Great. Well, I'm really thrilled to be here and to also be part of this panel. So my name's Tanuja Chitnis. I'm a neurologist. I'm a professor of neurology at Harvard Medical School. I have several leadership roles, and one of them is I direct the Pediatric Multiple Sclerosis Center at the Massachusetts General Hospital. And I also co-direct the Brigham Multiple Sclerosis Center at the Brigham Women's Hospital, which is about 3 or 4 miles away and across town, but we're all connected through one big MGB network, which is behind me. So we have a merger. And I also have several other leadership roles. I'm a neuroimmunologist. I trained in the laboratory, and I see some of my lab mates behind me in the audience. And I run a translational neuroimmunology research center where we do bench research, translational biomarker research, and also clinical trials. So everything from bench to bedside to try to bring new biomarkers and therapies to patients. And I have other leadership roles. I direct both the adult and pediatric fellowship programs through Mass General Brigham. And I also I direct the CLIMB study, which is our longitudinal study of over 2,000 MS patients. And I sort of balance it all with wonderful staff, with wonderful people that I work with, and just a great team. And overall, I oversee about 40 people with all of these different programs, and I'm financially responsible for about 20 to 25 people. So that's really key to think about how many people you are responsible for from many aspects. I have postdoctoral fellows working with me in the laboratory on projects. I have clinical fellows working in both the adult and pediatric centers with me, and a lot of students, and also coordinators and technicians and trainees from different levels.
Wonderful. Thank you for sharing that. Nancy, would you go next?
Well, that made me tired, Tanuja, just hearing about all the roles that you have. So I'm Nancy Sicotte. I'm also a neurologist. I'm here in Los Angeles, where I am the professor of neurology and chair of our Department of Neurology at Cedars-Sinai Medical Center. I hold the Women's Guild Distinguished Chair in Neurology, and I'm the director of our MS and Neuroimmunology program, of which Dr. Casey is my first fellow that we graduated. So that's really exciting. I also serve leadership roles within the department as the director of our fellowship program. And currently I'm serving as the chair of the National MS Society's National Medical Advisory Committee. And I'm also leading up their COVID-19 vaccine advisory group. So lots of meetings going on in the last year or so. So I thought these questions were really interesting and helpful to sort of think about the number of people that that you're responsible for. I haven't really sat down and tallied them all up, but we have about 25 faculty. We have about 30 trainees, and I'm responsible essentially for the overall goals of the department and for the financial well-being of the department. I'm also responsible for neurologists within our system at Cedars. And we have a hybrid system where we have medical group or their foundation-based neurologists as well as private practice. So if you add that up, it's about 100 people, which is why I guess the email never stops. But currently mentoring the whole gamut from medical students who rotate with us here at Cedars, residents, we have a fellowship program, as I said, and then I really, in some ways, serve as a mentor for all of the faculty, but in particular our junior faculty, of which we have several in the department. We have a young faculty, so that makes it really exciting. We also are involved in research, and my area of interest is in imaging, and I'm currently serving as a co-PI for the CAVS MS study, and we have a very active neuroimaging group here, including Pascal Satie and his research group, and also other biomarker projects of which Dr. Casey is involved. And so that is a really exciting piece of the work that we're doing here, moving the field forward. So I think I'll stop there and let our next panelist introduce himself.
Hi, thank you for the kind invitation to be part of this. And I enjoyed reading the briefing questions, and then also got a bit scared and overwhelmed after thinking about what I do. I'm also a clinical academic neurologist, like the other two panelists. I've grown into a whole bunch of leadership roles, like the other two panelists. I'm the professor of neurology here at Alfred Hospital, which is a very large quaternary hospital that has lots of really interesting statewide services, including in neuroscience, but also beyond that. It's a major transplant center, and burn center, and trauma center, and many other things that intersect with neurosciences. So in that clinical role, I look after about 9 medical and scientist section heads, and at last count, I think we had about 60 neurologists on staff, just in my section. And there are, of course, lots of fellows and lots of trainees. In the Department of Neuroscience, which is Monash University Department of Neuroscience, it's co-located here. It's actually probably more of a mentorship role, but there are 24 group heads, of whom Vilja and Anneke Vanderwald are 2 that I think are very active in the iWiMS group. And the whole department has about 200 staff and students. And then I'm also the managing director of MS Base, which currently has about 9 staff, and 4 of those are our section heads. So it's a busy life.
Wonderful. Thank you all for sharing that. And now you know that Nancy has been my mentor and is also now my leader as my chair, and is actually a great sponsor because she shouted me out twice in mentioning her own doing. So that's what a wonderful sponsor does. So as you all might know, iWiMS really was founded with one of the main goals to close gender disparities for those working in the MS world, both on the clinical and the research side. So we thought we would dive in with that in mind to the first question. And do you think men and women leaders are held to different standards? And do you think that there are different leadership opportunities offered to women versus men? And what has your experience been? I'll start with Tanuja for this one and then give the others a chance to jump in.
Well, there's a lot of questions in there, and I think they're all very important and very good. I think to answer the first one, are men and women held to different standards? I do think that they are, but this can be overcome in my experience. And I think what I've seen occur is that there's sort of an assumption sometimes that, you know, when you take a group of people in a room, who is the leader? Who is in charge of this group? And it often will immediately be assumed that it's a male. Sorry to the males out there, but you know, that's what's sometimes assumed. However, I do think that once the discussions do start and once people get to know one another, that oftentimes people's minds change and realize that women can take on these roles. And so I think it's very important for women to be engaged in the discussions, to volunteer, to put their names forward for leadership roles, because those stereotypes and those assumptions can change. And I've seen that occur. I think it also requires a bit of a push from the institutionally to say, well, why don't you take a look at women and see if they could be appropriate for those leadership roles. So I think this is sort of broadly answering a lot of the questions, but you know, in terms of are women and men held to different standards and assumed to be leaders? I think in terms of standards, there's maybe a, you know, also with historically there may be a little bit more of a leeway that is given sometimes to men, but I think ultimately, you know, we're all responsible as leaders, and I think that disappears very quickly when you really look at data, and data does drive a lot of what we do in medicine and science. So I think it's a very data-driven field. In terms of, are there different leadership opportunities that are offered to men and women? And I think there's two sort of mountains that women sometimes have to surmount. One is this myth that women don't do hard science as well as men. And that, in fact, was something that one of the former heads at Harvard had said in, you know, very misinformed statement. And I think that is an example of something that has been detrimental for women. But obviously, women have achieved a lot in hard sciences, and I think we still have to push our names forward and ensure that women are given opportunities in the hard sciences if they wish to. I think women are also more often offered opportunities in areas where there might not be funding, so committee work where there might not be reimbursement or funding for asked to volunteer time on diversity committees. So I think women should and do now ask for compensation in some way for participation. I think, at least that, in my experience, that's been the difference in opportunities that are offered. But I will say that, you know, any opportunity is probably a good one, to really put your name forward, to get out there, to say speak your piece, and to also be invited back. And that's something that one of the senior women in our institution had mentioned, that maybe you're invited to give a talk for a certain reason at a conference, but if you give an excellent talk, you'll be invited back just on your own merit. So I think take any opportunity that you can to put yourself out there.
Great advice. Nancy or Helmut, either of you want to chime in on the same questions?
I suppose, oh, sorry, Nancy.
No, go ahead.
I suppose I'm lucky that almost all very senior leadership that I interact with on the university side are women. So we currently have a female vice chancellor, a female provost, and a female dean of medicine, all of whom are absolutely superb leaders, especially the dean. Then my direct boss is a man, but he's also lovely and a great leader. on the hospital side, the chief operating officer, the person that probably operationally have a lot to do with, is also a wonderful female leader. So perhaps I'm living in a kind of unicorn universe here, where I don't see I see the gender gap reducing. My key beef with everything in science is it's not so much completely about women and men, but actually about relative to opportunity. So it turns out, as we know, that women are much more likely to spend a lot of time caring for others, parents, family, children, homeschooling, running back to school to pick up their children with a sniffle for the COVID test. And I work with lead, I suppose, in some ways, probably more mentor, a whole number of wonderful women, including Vilja and Annika, whom you know well in this group. And I see that stress and difficulty on a daily basis. And I think that overall, we don't judge merits or achievements when it comes to promotion sufficiently relative to opportunities. So people can write a little paragraph in their grant application, but nobody says, okay, because you had to spend 30% more time doing other things, I'm going to multiply your score by 1.3, because then only women would get all the grants. And this is really kind of a major issue that we're trying in kind of small ways to address and to raise, and the university is certainly extremely keen on redressing that, just to create a more level playing field, not actually to favor women, but just to say, well, relative to your opportunity, you've actually done amazingly better than this person, and therefore you should get this job.
So I'm going to chime in. I think there's a lot to unpack from those two descriptions and two inputs. So I really thank you to the panel members for, I think, bringing up many, many points. We could probably spend an hour on a lot of them, but I want to just comment on a couple of things that Tanuja said, because they resonated with me. I think in terms of men and women being held to different standards, I think a lot of it has to do with this expectation about how a leader will behave and what a leader looks like. And I think we all have this sort of template that comes from over, years and years of seeing, the white guy with the white hair in charge of everything. And I think that even if we know that as a stereotype, it still operates. We feel more comfortable sometimes when we're in a setting where we have a strong leader, and that kind of, because I think we're programmed a little for that. So I think the most important thing is just seeing women and people of color and people who are traditionally not in leadership positions, just to have them in those positions is hugely impactful. Because then the other younger people coming up realize, this could be me. They can identify with that person. So I think first and foremost, just to have powerful, mentors and powerful examples. And I've told this story before, but maybe not in this group, but my daughter, who I had when I was in medical school, came running home one day when she was like 6 or 7 and said, Mom, guess what? Men can be doctors too. Because she just assumed, because I was a physician, that all physicians were women. So one generation of experience like that. So I think having a seat at the table is incredibly important. I think also, though, there are barriers that are there for us, and I think Helmut was talking about some of that, just having to do with life expectations. And I'd be really interested to have a conversation about how you manage these responsibilities and how you make that equivalent, or how you figure out a way to take that into account. because I think that men and women don't have that equal burden maybe in some ways, or maybe we can find ways to make it more equal. But I also think that women, to Tanuja's point, are sometimes called upon to do things where there's an expectation that it's not the best job, and there may be an expectation that you'll fail. And they sometimes call this the glass cliff, not the glass ceiling, but you're asked to do an impossible job with the expectation that you might fail. And so when there's a really bad leadership position available, they might think about having a woman do that. So I think there are risks associated with that. But I also think that it is just over time and seeing the way that different kinds of leadership styles can be successful. At the end of the day, that's what's important. So if you can bring together groups of people to work effectively together and to move your field forward, at the end of the day, that's what's going to be most important. And I think in some ways, and this is maybe stereotypical, but I do think that women tend to be more collaborative, like to share responsibilities and maybe not go it alone. And given the complexity of the work that we do, spending time talking to machines and having to do a lot of verbal work, that is a little bit more, I think, in the wheelhouse of women, and may give them additional success. So I think it's a mixed bag, and I think that, but we've made enormous progress. I think we have to be open to different leadership styles, and at the end of the day, look at the data and see what works. So I'm optimistic about that. But I wonder if we could have a conversation about this responsibilities, because this is really, I have a lot of women faculty, young women faculty, and we have a joke about our department. It's the most fertile department ever. There's always 2 or 3 people who are out on maternity leave. And we have dealt with this, or I've thought about this, is just, this is an expectation. This is the way life is. And that we just need to build in some redundancy in our system to take it, to acknowledge the fact that this is part and parcel of people's lives, rather than an anomaly. But I'd love to hear what my panelists think.
Absolutely true. I think we have to think about this as not an anomaly, that women do get pregnant, and that we have to include that in our planning and thinking about personnel, about time, and just make this a norm. I think it goes beyond maternity, though, and I think childcare and management, at home is also part of this. And at least, some ways that I've managed things is because is having a wonderful partner and having someone who takes on, a fairly equal amount of work or role, and we both assume equal responsibilities. I'm not very good at fixing things, but I try, and vice versa. But I think just having some sort of equal responsibility, and understanding that there are times when one person's career is going to be very demanding, and other times when another person's career is going to be very demanding, and being able to compensate. But also having institutional and societal supports that help you, especially when you have young children at home. And very simple things like Amazon we have here, and grocery delivery, and things that we can call on to make our life easier have been very helpful now in the past few years compared to, say, 15 years ago when these things didn't exist. But I think we can continue to make these tools better for women, and investing in companies that are female run or understand the needs of young families, I think, is also very important. Childcare has been a really big problem, I think, for everyone, and finding childcare that's close to work or accessible and works with one's schedule, especially if you're on a medical schedule, is something that we've all had to contend with and really needs to improve.
Is it okay if I interject and maybe ask for some granularity from our sort of speakers? Loretta's asked, how many roles are enough. And I'll paraphrase that saying, I think young women in particular, and men, are a little perhaps gun shy to take on a role that may quickly evolve from a task pretending to be an opportunity. So I've paraphrased Loretta's question slightly. So I'd be eager to hear what you think.
Well, I'll jump in on that. I did a fellowship this past year, the ELAM fellowship, which is for women in medical leadership. And the idea is to build the old girls network, if you will. But we spent a lot of time talking about the value of your time and being strategic with how you dole out your time, both for your own, careers and development, but also that other people value your time. So you don't make yourself available all the time, because then people don't value it. I find it hard, that sort of idea, but all of the work that we did and all the things that we read about people who are successful are people who know when to say no, and they say no to most things. So I do think this is a challenge when, especially as you're junior and you're trying to, again, get at the table, sit at the table. You want to pick those high impact kinds of roles that really, and I would say something that you have passion for, that you really are interested in doing, right? Because you're going to devote extra time to it. But think about where it's going to lead, and is it going to be useful, and not just to sign up for everything. And also, this is also really hard. It's really hard even for me at this level, when you get asked to do something, to say no. So I was asked to be on yet another committee, a task force, and I could just tell from what it was, the way it was worded, it was going to not be a good thing. Like, you're not going to get any points for it. It's going to take a huge amount of time. So I said no, and I felt so empowered. And you know what? Nothing happened. The world didn't come, I didn't lose my job, or, so you can, and in some ways you get more respect, which sounds crazy. So anyway, that's a tough one, but I would say you should have fewer roles, but they should be high quality roles. I don't know what my panelists think.
So great answer. And unless anyone has a burning input, I'll move us on to the next question. We could probably spend the entire hour on any one of these questions, probably. Okay. So the next question is, have you ever worked under a poor leader, and how has that influenced your leadership style? Feel free to name names or not. Helmut, I'll start with you.
Yeah, I'm not going to name names, but the answer is a definite yes. And for the record, two in particular I'm thinking about have both been men. And I think that there's a lot of reflection there, especially once you escape from under the whatever torture you're in, which in one case for me took about 20 years. The Stockholm syndrome, right? But the but the key things are that leaders can and should be strong on occasions. But I think the key learnings, or things that I'm trying to do different, is obviously to avoid bad things, like not to bully people and not to tolerate, bullying in my sphere of influence, shall we say. I think not to lie. I think people who are, deceitful or lie and create kind of lower levels of confidence. And not to create like overtly bad situations. We all have bad days. We can all be in bad moods and occasionally even shout at people. And one of the ways of not making bad mistakes that stick in people's memories, I think, is to think proactively about stakeholders. Like when you're making decisions, think about stakeholder engagement as a thing, to actually talk to everybody who is going to be affected by within reason, who's going to be affected by these decisions, and are they on board, or can I bring them on board, or can I at least inform them? Because that sort of absence of internal communication can be really, really hurtful too. So these are some of the things that I try desperately to avoid as a leader. And I'm going to say one more
Sorry.
controversial thing. Sorry but the other thing is that leadership and mentorship are very different to friendship. Sometimes they can kind of be combined. But as a leader, you lead lots of people. As a mentor, professional mentor, you might mentor people a little bit or a lot. But you have to really, really distinguish that from friendship. Otherwise, you can get into a lot of trouble.
Tanuja, would you chime in? Have you ever had a poor leader, and how has that affected your leadership style?
So I just want to say I completely agree with everything that Helmut and Nancy have said so far. And just to add to this concept of leadership, I think, you know, what I've seen sometimes that has been poor leadership, not necessarily direct leaders for me, but in the sphere, has been when there's been divisiveness and trying to conquer, divide and conquer, essentially. And especially with postdoctoral fellows and authorships on papers, I've seen that become very divisive, and trying to put two people on the same project and having them compete against one another. I think that's not a good way to work, and I really try. I don't do that. I don't think I do that. And very clearly, I think it's important to clearly lay out the goals of a project or manuscript, because this is our currency in academia, is to publish, and we want to be recognized for that. So I think that's something that I've really seen occur in the past, and I think it's something very important for academic leaders to avoid. The other is assuming things about trainees, and sort of assuming that one individual trainee may be better just given certain background or prior training. I think that doesn't give an opportunity for other individuals to shine. And I think here, you know, we need to be objective, give individuals a chance to shine and give them equal opportunities. And I think that's something that I've seen in the past occur, and that really is something I work against or don't endorse.
I can offer one other tidbit, I guess, that I've learned from experience. I think that a leader should be focused on not using their power to advance their own objectives, but rather using their abilities to empower others and give other people opportunities. And there have been certainly leaders that I've worked with who seemed more focused on themselves and very transactional kinds of relationships with people in their sphere. And I think that engenders, I don't think that's the role of a leader. You know, as Tanuja was saying, we want our mentees to be successful, and we want to give them opportunity rather than think of this as a way to pad our own accomplishments or CVs.
All fantastic points. Thank you all for sharing. I have one more question for my section, and we're going to transition over to the mentorship part of this talk. And this question is, when do your roles as a leader and a mentor create a synergy with one another, and when do they conflict with one another? And so Nancy, if you want to start us off with this one.
So I think, you know, Helmut said this, being a leader and a mentor are different, and they're very different than being a friend. And so sometimes you have close relationships with your mentees, for example, and I think you have to be very, very careful about when you're in a leadership position over a wider group of people that you don't demonstrate any favoritism, for example. You could really want to, you know, create a situation that works out great for the people that you work the most closely with. So, and I can tell you, well, I also tell the joke that I have 3 daughters, and everything I learned about leadership, I learned from raising 3 daughters. And one of them is that they will be paying very close attention to what the others get. And so people who are when you are in a leadership position, your faculty or whoever you work with are going to be looking very closely and to see that that things are given out equally, and that everyone should have a say. And there's all sorts of other rules about raising siblings. But I think that is one of the pitfalls, and it may be unconscious as well. So I think you have to be very cognizant of fairness. I think that is one of the most important pieces of your credibility, is that you treat people equally. So that, but that also can be challenging.
Friendly. Helmut?
Well, I guess one of the problems with leadership is that many times these leadership positions don't actually have well-defined job descriptions, and you have to kind of make it up as you go along. So one of the things that I like to think about is the values of the organization or the team or the group that I'm leading. So, you know, the hospital and the university actually write down what they are supposed to stand for. And I think that that's your role as a leader, fundamentally. So, you know, in a hospital, it's about trying to provide excellent patient care and being respectful and fair and good to your staff, and, you know, strongly discourage bullying and so on. So there's a job description there. I think the difference between leadership and mentorship is actually probably just that. As a mentor, as a professional mentor, I think your job is fundamentally to help, support, give advice to someone to advance them, or give your experience so that they can navigate some difficulties that they find themselves in, you know, professionally as best you can. So it's very much an accountability to a person, I think. As a leader in an organization, you're accountable to your organization, much more so than just individuals within it. And you have to, you know, good organizations, like really great organizations, have mission, vision, and values, and everybody abides by them and knows them. And I can look up and down the ladder and say, well, actually, this person, okay, this decision didn't go my way. They, you know, they didn't do what I wanted, but I can see that that's actually on point for the values of the organization.
Excellent distinction. Tanuja?
I absolutely agree with everything has been said. I think maybe to think about, you know, where there's synergy and where there might be discord, I sort of view leadership as leading a project, leading towards a goal, and mentees might participate in that project to some degree. You're also responsible with mentees for guiding them, teaching them, and they may or may not be up to all the roles of a project that you're required to lead. So I think that's where the discord might occur. And I think recognizing that might occur, and that, you know, maybe it's not the right role for a mentee to be involved in a very goal-oriented project, but they might have a different role in something else. That's where I think it's important to understand the distinction.
Thank you. So I guess, you know, we've spoken about perhaps the distinctions between leadership and mentorship. And since you're already speaking to that, Tanuja, I think I might ask you the next question as well, which is to ask, you know, which one do you think came more naturally to you, the leadership role or the mentorship role? And I guess just to add to that a little bit, do you think that your training in either medicine or in science helped you with either of those?
Yes, so very good questions. I think I'm going to give you a surprising answer, because, you know, I think the role that came more naturally to me was the leadership in terms of project management, deliverables, fairly goal-oriented. So that actually worked out fairly well for me. I think the thing that I found, you know, I worked on more, and actually having children really did help, was mentorship. And really understanding that each individual mentee has their own strengths and challenges, and it's my role to help guide them through those and reach their goals. So I think that's really where I thought about it quite a bit, and I'm still continuing to do so. And having children has helped immensely in that. Does our training in science and medicine prepare us for either of these? Not really. I think if you look at classical medical training or a PhD, I don't think that we're really management, mentorship, teaching skills into those types of courses as much as we should.
Nancy and Helmut, did you have anything that you wanted to add to that?
Well, I wanted to answer the question because I thought it was an intriguing question. And I think mentorship definitely came easier to me. I was a little uncomfortable in some ways with taking on a very visible leadership role. I like to collaborate. I like to work in a group. And I think having that, it's both the responsibility, but also the visibility that, you can screw up. And so that can be, and you have to take responsibility for when things go wrong in a very visible way. So that was, I think, challenging, but it's also invigorating because you have an opportunity to really do some things and have power and be the queen, as I've told Mara before. It's great to be queen sometimes. But I think in terms of our training, I think we could do, as Tanuja said, a much better job of preparing people for leadership roles. I think there is some mentorship in, the way that we educate medical students and residents as you go along. You take on a responsibility for teaching, and so there's a little bit of that mentorship. But I think we could all benefit from more focused, structured teaching in that regard. But Helmut, what do you think? What came easiest to you?
I would actually totally agree with you, Nancy. For me, also mentorship came easier. Perhaps because I grew up, in medical training, and there is sort of a small hierarchy with consultants and fellows and registrars and residents and very junior doctors. And there's also quite a lot of closeness, towards a common goal, sometimes working very hard and often working very well together. So you experience that kind of at close quarters, if you're a junior doctor working with a registrar, one of whom is actually now my boss all these years later, you do develop a mentor-mentee bond, and there's quite a lot of modeling in that I think I liked and was relatively easy to translate. Sure, there's leadership components to that because it's hierarchical, but taking on larger institutional leadership roles, I've actually found very difficult, simply because it doesn't have that yardstick of what you are supposed to do, and actually you have to invent your own job description to some extent. So you have to search for yardsticks to say, internally, what am I going to measure my performance and my actions against? I think that's my answer.
Thanks, Helmut. So for the next question, I'll throw this one to Nancy first. And again, it's a two-parter just because I can. And so I guess this really stems from the mentorship program that we're running within iWiMS, where it's a bit of an arranged relationship. We do our best to identify volunteers within the program who we think might have a common interest, whether it's research related or based on their clinical expertise. And we've also tried to really capture the spirit of iWiMS in terms of trying to also include some geographical diversity in this. So we're trying to match women across different parts of the globe as well, and different ages and all sorts of things like that. But I guess the question really is, do you think you can have a successful arranged mentorship relationship, or do you think this is something that has to evolve more so organically? And so then feeding into that, what do you think makes a good mentee-mentor relationship?
Yeah, so this is a very detailed question that again, I think we could spend a lot of time on. So I think it's important, especially for junior people, to just give them a mentor. We did this with our residents. We just assigned them, unless we knew beforehand that they were absolutely focused on stroke or something. But even then, I think it's better for them just to have an opportunity to have a relationship with someone who's more senior, and with the expectation that they're going to be talking about their needs and their goals and helping them shape. I think just having that formally, like going to a therapist, I guess, is just helpful. It allows you to have a space where you can really focus on yourself. So I'd say that in and of itself, and I think it's fantastic that you're doing this broad exchange across different disciplines and different ages and different experiences. So I think that's really a rich experience for the mentee. But what I always think is that you never have just one mentor, right? You need mentors for different parts of your life, for different stages of your life. And I always tell the residents that they should acquire a multitude of mentors. So by the time they finish training, they should have several mentors. And it may be that there are some that you leave by the wayside, you don't interact as much, because that whatever that need that mentor served has passed. Although I think most people like to keep in touch, and whenever you mentee someone, it's almost like you have this pride as you watch them grow and achieve, and you always take pleasure in seeing their success. But I think of it as a process rather than a single relationship. And then the other question about what makes a good relationship. First, I think the mentor should be focused on, what's best for the mentee, of course. But the mentee should come with some ideas and some specific, the mentee has to do a little bit of work. It's not just coming and saying, help me succeed. The mentee has to come with some very specific asks and ideas about what they want to gain from the relationship or what the mentor could do for them. And then I think in that setting, the mentor has a lot more ability to, use their resources or their connections or get them, serve the needs that they have. But I think that whole relationship building is an important process that the mentee will go through in identifying what their needs are.
What about you, Helmut? Did you have some additional thoughts to add to Nancy's?
I think Nancy's been incredibly eloquent answering this. I think both things can work, and whether it's arranged or not, there has to be a certain sparks. It's kind of the wrong word, but there are some of these relationships that evolve to work much better than others. Others just fizzle out very quickly. But I'm not sure that you can necessarily pick the ones that are successful by matchmaking. So I've seen both styles work.
Tanuja, over to you.
Yeah, I think those are all great points. I'll just add that I do think that multiple mentors, and maybe at different stages or at the same stage, is very important for anyone to have. Different viewpoints, different skill sets that you can learn from. So those are all very valuable. I do think that a good relationship is probably two things. One is a common interest in the theme, and also just a personal connection or an interest in getting to know one another beyond the work, let's say. I do think also there has to be some goals that are set in this mentor-mentee relationship, and both have to meet those goals. And it's helpful to write things down, to keep a running list of what the goals are for this project or relationship, but not to stick to them too definitively, but at least have some general goals that you're hoping to achieve.
Thanks, Tanuja. Now, I'm really conscious of the time at the moment. So in the interest of time, I'm going to actually skip to the final question that we had sent to our panelists, because I think that this is a really interesting one. And I'm actually going to start with Helmut, because I think that was the order in which we were going at the moment. And so my question is, do you think that women benefit from men mentors, and vice versa as well?
That's a really difficult one.
That's why I asked it.
What do you think, Vilja?
That's why the panel is here. I personally, yes, I do, because obviously you've been my mentor for many, many years, and and sponsor, and I've certainly benefited from that. But that's me.
But is that fundamentally because I'm male? So, there are, if we're talking about classical ultra male and ultra female traits, whatever they are, we actually all sit on a spectrum somewhere, right? We're all personalities with on lots of different dimensions, and being male or female is an attribute, and there's of course gender roles and societal expectations, but in the end there's lots and lots of different men and lots of different women. And I think the conversation has to be a bit more granular. I think so. I'm going to say no. It's not sort of the most important or very important ingredients in why mentor-mentee relationships can ultimately be really successful or not. But I'll be really interested in Nancy and Tanuja's view, especially so I would say that my two strongest or best, most valued mentors in my life have been a woman and a man. So I'm 50-50. What do you think as women who are mentoring men?
So I think this is Helmut, it's the first time I've met you, and I can see why you're a wonderful mentor and you're such a thoughtful person. So you're very intriguing responses. But I guess the way I think about this is more that it's good to have a mentor that has strengths where you have weaknesses. And so for some that may be, somebody who's an uber male with uber female, but it might not be. So I think that those relationships benefit the mentee in particular when you pick somebody who's very strong in something that you might feel weak in. And so that may, as again favor these different genders, but might not. So Tanuja, what do you think?
Yeah, first of all, I really want to endorse the thought that Helmut brought up, was that we're all generally on a spectrum, and I see a lot of males in this audience. I think that not everyone is a ultra female or ultra male, and I think we all have traits, and also probably men would also benefit from having female mentors. So I think there's skills that you want to learn from a mentor. I think it doesn't necessarily matter if they're male or female. It's really skills that you're hoping to learn and attain. So I think that should really be the leading factor. But I think also what we can learn from one another is how we interrelate with people, with groups. It's been sort of said on this call that women are quite collaborative. Men might have different styles of leadership. And I think just taking those examples, being in those spheres and being exposed to these different styles, you will pick out your style from all of these different options. And so I think it's good to be exposed to different styles, different learnings, and put it together for yourself, figure out what works for you. And I benefited greatly from both male and female mentors.
Well, I know we're at the 2 minutes from the sort of top of the hour, and I wanted to thank our phenomenal panelists, Helmut, Nancy, Tanuja. Thank you for such an insightful and engaging kind of conversation. And I also want to actually commend Vilja and Marwa for fabulous questions and really using the time well. And Fabienne, who was graced under pressure, despite significant cyber challenges, Fabienne. You landed us all beautifully. And I think this is a really good beginning of what should be an extended conversation. And so with permission, we could perhaps even collect questions that we could find a way to circulate to our panelists, and maybe even segue into a future mentorship talk combined with leadership if Vilja and Marwa are up to the task.
Absolutely, Fiona. And again, from me as well, a very big thank you to all of our panelists for putting yourselves out there and for sharing your very personal experiences with us today. So very much appreciated. Thank you. And to everyone who dialed in as well.
From me, thank you all to our panelists. It was such a treat to hear all of your experiences and your different takes on our questions, and to everyone who joined us, and hopefully those who are also watching the recording later. I know this was a difficult time for our European members, but between Australia and the US, this was the best that we could do. So thank you all for joining us, however you did so today.
Thank you for the opportunity to participate.
Yes, thank you so much for the really intriguing questions.
And I will
We
say
didn't make it easy on you.
I would be delighted to continue the conversation. I think this is really fun, and be happy to answer any other questions that come up. So great to meet everybody, and it's nice to be together.